Welcome to the Health Leader Forge, a joint production between the University of New Hampshire and the Northern New England Association of Healthcare Executives. My name is Mark Bonica, and I am an assistant professor in the University of New Hampshire's Department of Health Management and Policy. Today's guest is Brian Hall, the president of Physician Resources Limited, a revenue cycle management firm based in Merrimack, New Hampshire. Brian was employee number one of PRL more than 30 years ago, and on his way to being the president and eventually the owner of PRL, he did everything from sweeping the floors to business development. In this podcast, we talk about Brian's career and what it's like to be an entrepreneur working in a family business. I hope you enjoy my interview with Brian, and if you do, won't you take a moment to leave us a rating on iTunes, Stitcher, SoundCloud, or wherever you may be listening to this recording. It helps other people find us. Thanks for listening, and here is Brian Hall. Welcome to the podcast, Brian.
Thanks, Mark. Happy to be here.
So normally I don't mention the date that we're talking on, but this is kind of unusual time. So today we're talking on April 3rd of 2020. And the world has kind of taken a hard left as we have been hit by the COVID-19 coronavirus. And so don't usually mention that, but and because we don't usually talk a lot about current events, but I think it's appropriate today to talk a little bit about leadership in a time of crisis like this. So we'll get to that as we go through the chat today. But before we get to that, I want to kind of start with my kind of more standard approach, which is I'd like to hear how you got to be president of Physician Resources Limited. So we were chatting a minute ago before we got started. You actually started in 1989. So tell me about how did you get involved with Physician Resources Limited?
Yeah, so correct. I started in 89 part-time, and interesting enough, at the time I was working a few different jobs. I grew up in a family of dairy farmers, so it was either get into the office and find an office job, or it was continue to be work on the dairy farm, right? And I was doing both and a few other things, but. So I was attending UMass Lowell, and the girl that I was dating at the time, her family had founded this at the time healthcare software business that evolved into a revenue cycle firm, and they were looking for a little part-time help around the office, and it was about 1.5 miles or 2 miles from the university, so it made good sense for me. So I was going full-time, commuting to school, and then I would work there either before classes or after classes. During the 89, 90, 91, and I was doing everything from sweeping floors to stuffing mail to helping them clean out the stock room. So it was an interesting time.
So you really started at the bottom.
It did, yeah. I tell you, it is funny, and having been here now 30 years, or a little over 30, I guess 31 years technically. But I've one of the things that, and you'll see as we go through this, I've literally done every job in the business at one point or another, which I think has helped in a tremendous way, especially as I rolled into the president's role.
Yeah, absolutely. And I imagine creates a lot of credibility with your employees, right? You've done everything from sweeping the floors on up. So that's pretty cool. Yeah. You don't hear that very often.
No. So
you worked part-time for a few years, yeah, and then eventually started full-time. What made you decide, this is something I want to do full-time?
It was interesting. I had always grown up being around a lot of entrepreneurs, and one thing I did know, and I don't, is a lot of kids come out of high school, and you think you have to have your life figured out, right? And I have this conversation. I have 2 boys. We have this conversation a lot. Is you don't necessarily need to know what you want to do, right? And part of the one thing that I really was always intrigued by is being self-employed and small business. Growing up on a family dairy farm, I had uncles that were electricians that had their own businesses, landscapers, and various things. And during the time, as we talk about mentors, I think at some point is, my stepfather had owned his own machine shop and still does to this day. So I'd always seen these different, independent businesses. So the one thing I did know is I wanted to either be in my own business or in a small business that I had a substantial impact, where I saw a lot of my friends going into the corporate world. It definitely was one of those areas that never intrigued me. So I was paying my own way through school at UMass Lowell. And obviously, commuting back and forth, and the opportunity arose. Their business started to grow a little bit. We had some conversations. The plan was for me to continue to go to night school, but eventually had the opportunity to jump in full time. It was really, I think I was the first or second. I guess there was maybe one other part time person that joined it as the non-ownership. role, employee. So it was an interesting opportunity. One of those things I didn't think I'd be there 30 years, that's for sure.
Yeah. Yeah. So you're kind of employee number one.
I was,
like full time, right? Yeah.
Well, yeah, the first paid employee, I think, is what it from that point. So it's kind of cool. Yeah.
So the business was growing. They brought you in, and what were you doing? Kind of at the beginning when you came in full time.
Yeah, and revenue cycle today is a lot different than revenue cycle in early 90s, right? And we'll talk, we'll get into that, I'm sure. But it was so when I started, I was really what today we call a billing clerk. I'm not even sure I really had a job description, quite frankly, back then in a small, bootstrapped company. Where there's three of us doing everything, but I was producing insurance claims. Which at that time was all paper. I was, doing courier routes, delivering stuff to physicians' offices that they were working with, helping them set up computers. It was, various different job duties at that time. But, if I looked at it today, a lot of what I did would be what we'd consider kind of an RCM entry level position.
All right. So this was back in 91, 92 timeframe.
It is, yeah.
So I know, and that's actually, kind of the same time frame for me. So I've talked about this before on the podcast, but I joined the Army in 92 and became was a medical service corps officer. My first job was working in practice management. So the funny thing, as I look back on that, is working in a clinic, there was exactly one computer in the entire clinic, and it was the secretary's, and she basically did word processing on it. So, you said that the company started as a software company and kind of evolved into this more RCM function. So what did PRL look like? You said 3 employees at that point. What had they been doing, and how did they evolve into this more, into the role? I guess, what did RCM look like at that time?
Yeah, so I'll back it up a little bit. So when I came on, their primary function was they were a New England distributor reseller for a software company out of Seattle, Washington. So this company, Practice Partner, Andy Uri is the founder. We still keep in touch with him. He was a primary care physician out of Seattle, Washington, that had developed in the early 80s one of the first EMRs and management systems. So it was all DOS based. It was incredibly primitive by today's terms, but so they had more or less stumbled on him. My father-in-law was an air traffic controller and ended up being unemployed during the Reagan years and was looking for something new and new health. And they always enjoyed healthcare. My mother-in-law at the time, who was the other founder, was working in orthopedic practices. So they more or less stumbled on this company out of Seattle that was looking for a New England dealer. They scrapped the money together and bought the New England dealership rights. So when I joined, the primary focus was selling software to independent, small physician practices, small to medium, maybe up to 20 docs at the time. So a lot of when I joined was a lot tied to that. But the other part is a lot of the sites they were selling the software to realized they couldn't manage the billing piece of it as it was getting more complex in the 90s. And when billing in the 80s was pretty straightforward, right? You sent the claim in, you actually got paid, right? A little different than the environment we live in today. And what was happening is that was getting more and more complex, more regulations. This is before pre-HIPAA, but there was still stuff starting to pop up around electronic claims and so on. So a couple of the sites came back to the company and said, look, we love the software, things are going great in the office, but we need help managing the billing piece. So what ended up happening is they took on a couple of sites, one orthopedic practice, and I think the other one was a GI practice in Massachusetts that they were going to temporarily help them get their billing in order. And then 30 years later, one of the practices was still there, but it's still with us, just retired actually. But it was something where they said, okay, yeah, we'll help you out. We understand how to flow. And I came in to help, bridge that gap. And then they realized doing this that, hey, this is a pretty interesting model. And during the 80s, a lot of companies were starting to spring up, right? This is pre the big guys, the Athenas and the GEs of the world and the large competitors that we see out there, but in Optum now. But there was a lot of kind of mom and pops springing up in this industry, and that was really kind of the beginning of where you saw a rev cycle, and then it just completely expanded from there. So when I joined, it was a lot of software related, and then I was supporting the RCM side probably half the time, and then that continually, and then we took on a third client, then a fourth client, and then eventually the RCM became the core focus, and they got out of the software business entirely. I think in the 90s actually.
So you kind of eventually had the role of billing manager as kind of your first formal role. So the firm was growing, I assume. You continued to grow, and
It was slowly growing. Again, being a private business, they did the investing, grew the business themselves with their own capital. So it was a slow burn to grow it, which I think was the right way to grow it. But yeah, the rev cycle business was growing. If I started as a billing clerk, I moved into what we'll call a billing manager, which means I'd have a chunk of clients I was responsible for. So, I think at the time I maybe had, when I took that role, 2 people reporting to me, part of the team, maybe. Yeah, there's 2 at the time. And ultimately we were responsible for all aspects of billing. So from the charge entry piece, coding at the time, ICD-9 coding, and CPT was still there. And then we would produce the claims. And at that point, some claims were produced on the system. Some claims we were actually typing on HIPAAs. The old school typewriters. Still one of the best classes I ever took in high school because I can still out type. One of my typing skills have been honed over the years, and I'll credit it to the HIPAA forms of the 90s. But so we were responsible for all of that, and then we'd also be responsible for taking obviously the payments and posting the payments, billing, producing statements to the patient. So we ultimately, in the old days, we handled the whole aspect of it, right? We call it old school billing, right? We did all of it. Very different than it is today, but you really did all aspects of it. And I was responsible for, at that time, I think I had 4 or 5 clients. They brought somebody else in that was handling the other 2 or 3 clients, I think, at the time. I think we were maybe up to 8 clients, somewhere in that range.
All right. So you eventually, you got promoted up to be director of RCM operations. So I guess the firm had grown some at that point, and you continued to mature kind of in your skills.
Yeah, I think I was maturing. Still, I think, at that time I was probably in my late 20s, right? That was, if I recall correctly. But so the company had started in Lowell. We had now moved to Merrimack, New Hampshire, different location than we're in today. This is round 2 in Merrimack for us. And we were in a new space in Merrimack, and actually, we only spent about a year there because we were actively looking for a new building, and we bought about a 12,000 square foot building in Amherst about a year later. But so we moved to Merrimack. At that time, we had grown enough, and they needed the owners were primarily focused on sales and business development and client relations, right? And they were ultimately the ones responsible for presenting to the clients monthly and dealing all of that. And then I was focused on the internal day-to-day operations, making sure everything got done, making sure the trains ran on time, right? And that was the key of that piece. I did, and obviously was also responsible for that point for hiring, developing the staff, and continuing to build the team when we brought on new clients.
So were you primarily, so this is a growing business. So what I'm hearing is 2 owners, kind of you, and then you were running kind of the back office. So they were out generating the leads and working with the clients, and you were kind of running the actual operations.
Yeah. And being a small business, I was I was the one, I guess you could call senior leader at that point, right? Reporting directly to the ownership. And we were up in double digits of employees at that point. I don't know if it was 10, 15, but it was close. But ultimately I was responsible to make sure everything got done, and we delivered, and payments got posted, and so on and so forth.
How did you discover you liked this stuff? I mean, so you'd kind of been in it at that point. You've been in it for a few years. At what point did you kind of say, this is kind of cool. I like this. I like the operations. I like the accounting.
Yeah, it is interesting because revenue cycle, and I joke with my family, I'm not sure my kids understood what I did until about a year ago, and they're 18 and 19. I'm not sure my wife understood exactly what the business did, but because it is, it's an interesting industry, and you don't really know about it, right? I mean, I think now you start to learn about it at school, but when in the 90s and even in the 80s, nobody knew what RCM was, right? I don't think it really, we called it medical billing, but even then, I think everybody just assumed you went to the doctor and the doctor got paid. So it was interesting enough I'm a numbers guy, and I like numbers in the RCM, but the other part for me was really just the idea of growing an independent business, right? I think it was the nuances of a business, being involved in various parts of it, and really understanding, seeing the hard work and the development and the pieces needed to grow a business intrigued me. I think the healthcare piece grew on me, right? I think, and I talked to a lot of my colleagues about it, right, that have gone into healthcare kind of by accident or on purpose, and then come out and then realize how much they really love healthcare, right? And as you get more into RCM, it gets in your blood. And I think part of what our mission here and what grew on me, I think, as I went through the process in the 90s and in the 2000s was the ability for us to actually help providers. A lot of these providers who we were servicing at the time were independent, entrepreneurs trying to run their own business and see patients. And the flip side is I saw that we were reducing costs. So I'm looking at healthcare. We're saying, even back then, healthcare was a big cost and continuing to grow. We were able to do it more efficiently, do it for less, ease the pain of the providers worrying about what was going on every day in their office from an administrative standpoint. So that part really, I saw the need for it and I think really got me excited about it. And then the flip side was just I loved running a business, and and going back a little bit, even before when I was working here part time, I had looked at potentially I had a grandfather who mentored me a lot, who owned the dairy farm, but he also had a bunch of side businesses, and we had talked about starting a landscaping business together. We had talked about looking at buying a franchise, so I'd always wanted that piece of being independent. That was a part for me that really intrigued me about the business. And then as you get into healthcare, you realize, wait, hey, you are making a difference, right? I'm not saving patients' lives, and we're not as a business, but we are really helping these providers. And the flip side is I think we're reducing costs and some of the things that go with it that I think really had a good, a substantial positive impact on the healthcare community.
So I'm curious. So you said you went from, you were basically managing 2 people at one point to, you said, at this point you were kind of managing double digits people. So one of the things I like particularly for this podcast is, young people listening to this, thinking about moving into leadership roles and kind of growing as a leader. What was that like going from, and I would say, let me preface this by kind of my thought here is, if you had been in a big corporate setting, you'd have lots of infrastructure to kind of tell you, support you, and this is how you become a supervisor, and this is how you become a second line supervisor. You're kind of there. You're like the guy, right? And I don't know how much background your owners had in kind of leading large organizations, but and 20 people is not a large organization, but it's not, it's not 2 people. There is a different skill set as you kind of increase both the number and layers. So what was that like, kind of making that transition for you?
Yeah, it's difficult. And I think there's a couple of things. Everybody wants to get into management sometimes until you get into management, right?
Right.
I think and to your point, I think what's different in a small entrepreneurial business like that is there's not a lot of structure. And fortunate enough, we've been able to build it, now that we've grown a ton, but it's a different environment. There's no formal training process on here's how to manage, here's how to do a review, right? There's things you have to learn on your own. And for me, it was a difficult, and there's a lot of lessons you learn. It was a difficult transition for me, right? You go from being an individual contributor that you can kind of grind through and get your work done, right? I know if I had to work 7 days a week, I could still get my work done, right? And you can work long hours. That doesn't work and from a management standpoint, it's more about, mentoring and planning and time management and delegation and all the pieces that you don't learn as an individual contributor. So it was definitely without question. I mean, and if we get a chance, we'll talk about, there's more failures and successes early on in those roles, right? And I think that's a part of any leader's development anyway, but it was challenging. And I spent a lot of time, I had the fortunate at the time, again, I had a stepfather running his own business that had a similar size group of employees. I had a grandfather that was running a couple of different businesses that I could bounce ideas off. And then and then a lot of it was, and then my mother-in-law, who was the most active part of the business, had run practices on a smaller scale, but at least we were able to bounce ideas off of each other. I had friends that worked for large companies. So it was a lot of the one thing I wish I did more of then that I do a lot now is, and I think a lot of young people are getting better at it, is developing that network and not being, putting his pride aside and not being afraid to call somebody and say, hey, I got a problem and I have no idea how to deal with it, right? When you're 25, 26, 27, that's probably a harder proposition than it is when you're 50. But I think that to me, I was fortunate that one of the things, and we do this here, is you got to let people make mistakes and figure it out a lot of times on their own to a point. And I think if you're not failing regularly, you're not trying hard enough is kind of my stance on it. So it took a lot of energy. It took a lot, I spent a lot of time. I was doing some, I took a couple of classes. I actually at the time took some management classes at Riviera University at night, just to help, get through some through some of the, kind of expand my knowledge. Time, there wasn't a lot of online school. Nowadays I can get podcasts, I can get anything I want, right?
Right.
There's so many resources. And at the time it was harder, right? It was either go to school or it was find mentors or whatever was available. So it was a lot. It's challenging. It's a different, and I tell that to my young managers here, and they go through our leaders as we go through it, is you have to, there's a different skill set. So and I think a lot of companies, and trust me, I made the mistake several times over the years, is promoting someone just because they're a great person and a great individual contributor. You put them in a management role, it's a whole different mindset. And it took me a good, I think, 3 years to really get comfortable with it. And you're never fully, you're always obviously developing every day, but it took I'd say probably if I remember back about 3 years, and I made, you make some substantial mistakes, right? There's people I probably could have kept that could have grown with a business if I would have managed that relationship better, right? And I think that piece of it. So
Another, I guess, related question is, you have gone through the growth cycle of this business. So from the very kind of the most earliest stages to a point where you've got a fairly substantial business now. And that process you mentioned of formalization it's pretty well documented in the business literature. But I'm curious to hear what was it like as you had to formalize, right? Perhaps I assume you have like formal evaluations now, maybe, but you didn't, I assume, back in the day.
Right. Yeah.
So,
what we always did, and a lot of, one of the things I've been fortunate of, is a lot of my core leadership has all been here. There's a couple of them that have been here 20 plus years, several, and a large chunk of them have been here north of 15 years. So we always, we have our weekly leadership meetings and so on. We always joke about we've become a real business, right? So we, not that we weren't a real business before, and I never think anything. Right. It is interesting. You have to, you talk about how HIPAA impacted us, and I think hopefully we'll talk about that, but just the HR pieces that you had to put in, and the processes around reviews and formal development plans and professional development, and it's an ongoing process, obviously, for any business, but we had a period where you go from 2 employees to 20 or 25. There's a bunch of policies that you need to put in relatively quickly to be able to make sure that you're compliant, and you're, more importantly, I think, supporting the staff. That's the key piece, and giving them the ability to grow and do the right pieces. So it was a lot of bringing in outside. We brought, had outside consultants help us. We hired some skill sets, HR management, HR consultants, finances, the other piece, right? For me, that as you get to that point, you actually have to start keeping real budgets and maintaining your financials at a different level than you do when there's you have 5 or 6 employees. Changes things quite a bit. So we relied on a lot of outside services. And then it was a lot of just finding the right talent. My director of client or employee engagement and culture actually came in she had started with us about 18 years ago in an admin role. She was also doing the HR piece as part of that admin role, right? So she's evolved as well to the same role, and really taken it to a whole other level in the last 3 or 4 years, which has been awesome.
This is kind of still the 90s, so we're still talking in the 90s. That was I shared my story of my first clinic with 1 computer, but kids listening to this today can't probably, because they carry a computer in their pocket all the time, can't even imagine. I mean, like I said, that 1 computer wasn't even connected to a network. We didn't know what a network was really, but by the end of the 90s, we were moving fast in terms of the deployment of automation throughout pretty much every industry. How did that impact kind of your business, its growth, how you did things back then?
Yeah, it was interesting. To your point, our first computer was a compact that was portable, but when you say portable, it was on a wheeled dolly that just allowed us to move, right? That was the first computer I worked on, flipped out keyboard. And then, so the late 90s, we would have moved into Amherst, into our new space. And at the time it was, our technology, we thought we were cutting edge. We brought in a Novell network specialist, right? So we had a server in the closet, more or less, and a server room, but we called it the server room. It was a closet. And we had started to actually network a bunch of what we called dumb terminals at the time, right? I think they were in a. Yep. I don't think Dell was making them, but there was somebody similar that was pumping them out. So we had obviously started to develop the network. The biggest thing, and I think the biggest change during that time, was electronic claims and electronic payments, right? So I think what affected us was the move from paper HIPAAs and really a paper-driven environment where you were submitting paper claims, you were receiving paper checks, you were receiving paper remits or explanation of benefits, and so on. And so really what that started to jumpstart the industry, right? Because physicians' practices weren't prepared for the advancements in technology. And I know, in this area in particular, the Medicaid and Medicare plans were now accepting discs, right? You would submit a tape of your claims. They would pay, and then they send the tape back to you, and the tape would have all the explanation of benefits on it. So it was electronic, but it was kind of hokey electronic, right? So, and you think about it in a physician's practice, most of them didn't have the capability. This was before 855s and everything, but there was still a standardized format. So that actually helped the growth of our business. And I think that's a common theme as a lot of these regulations come along, is a lot of physicians in practices and hospitals and surgery centers, whatever it might be, have a hard time keeping up with the regulations. So the same thing was true in the 90s. So one was the technology, and then the other part was a lot of the regulations and claim submission formats. So that pushed our growth. We, I think, went through a pretty big growth spurt, late 90s, early 2000s, and it was changing how we did things. I mean, you were still not very automated, but because everybody was not. That was pre-EHR adoption. So physicians' offices were still using paper encounter forms. They'd send you a paper encounter form. We'd key it into the system at the time, which was still the practice partner system, and then we'd create digital claims, right? And that was only acceptable at the time. Medicare, Medicaid, maybe Blue Shield. Everything else was still paper HIPAAs, but it continued to push the growth, and it was, I think, made our lives in a lot of cases from a billing standpoint cleaner once we got the digital pieces of the claim submission down. But it really made it, I think, more difficult on practices, and that's where they pushed out. We're more outsourcing friendly.
And that's actually what I was going to make. So it sounds like this change actually played strategically into to support organizations like yours, to make it really it created an opportunity for you to add value to the physician practices because they didn't have the organic capability.
Correct. Yeah, without question. And it was. And the next iteration of that was HIPAA as it came through, but it really allowed us to, most of them realized, and I still, it was amazing to me how many physicians even have computers back then, right? I mean, there was still practice, right. Nothing, paper scheduling books. And this went on for, not for another, decade probably, but so there was no way they were going to be able to submit electronic claims to Medicaid or Medicare. So it really, really pushed our growth, which was nice.
So you mentioned HIPAA. So that's the Health Insurance Portability and Accountability Act, and that was passed in 1996. So probably most people have heard HIPAA. So talk about what was HIPAA, what is HIPAA, and how did it impact your business?
Yeah. So at the time, one of the things that happened in our industry was the formation of the Healthcare Billing and Management Association. So the HBMA is really the only trade organization that works with billing services. Obviously, that's specifically for medical billing and RCM. Obviously, you got HFMA and others too. And they had started. And I actually think they were called the International Billing Association at the time. But they started right around the time that HIPAA came out. And so HIPAA had initially didn't have much of an impact on us, right? I think it got passed in 96, but most of the adoption came later. So really not much of it, I would say little to no impact in the late 90s. We did do some policy changes. Obviously your compliance plans and your HIPAA compliance plans we developed, but which are completely different today. But it really started to have a push, into I think early 2000s when a lot of the regulations came due and providers were forced to follow HIPAA regs, which again pushed, I think, the technology piece, right? This is where people wanted to get away from paper claims, get away from the paper process, and the EHRs were coming out of it too. But similar scenario, it definitely forced us to tighten up some things, right? We had to get better at privacy. We had to get better at security, both physically and, technology wise. And, make sure that we were proactively auditing ourselves and external audits. But in turn, again, it was another thing that providers just didn't, as healthcare reimbursements were changing and regulations on providers, the more they got regulated and more they had to understand that a lot of these smaller practices didn't have the bandwidth, didn't have the knowledge. And again, it helped it helped outsourcing. And I think all of these you'll see is the evolution of where we're at today. But it really had the same impact, I would say, as some of the other technology advances over the years. Electronic claims, different, but similar in a lot of ways from an outsourcing standpoint.
So early 2000s, your title changes to Senior Vice President of Client Services.
Yeah.
So how did that reflect the growth of the business and kind of what you were doing?
Yeah, and I think this was a role that was an interesting change for me, because internally, historically, for the prior 10 or so years, I had been primarily operations. So this took me to the outside, right? So now I had some business development responsibility, but most of my responsibility was tied to, keeping clients happy, right? Client relations, making sure they're getting the service level they need, we had brought somebody in to help run operations internally, and really allowed me to focus on that networking piece with the clients, development of the clients, presenting financials, and so on. And this is always, there's my first meeting when I rolled into this role, and at the time, my now mother-in-law, she was my mother-in-law then, I guess too, but was doing a lot of the operational work as well. She had stepped into some of the operational stuff and allowed me to focus on this piece. But it was interesting because it was my first experience sitting in front of clients. And in that time, we had some fairly, for back then, larger practices, 10, 12, 15 docs. And it was, I tell the story, is my first meeting was at Kearney Hospital in Dorchester. And I still remember it to this day. And I remember the senior doc, who has since passed, but large primary care practice, and we weren't performing at the level we should have been. So my first meeting ever with a client was, and at the time I think we maybe had 30 employees, something like that. So we were bigger, but not huge. And I sat in that meeting and thought I was prepared. I wasn't prepared. And and it was an interesting challenge. It was something to this day I remember. And I use this story when I talk to a lot of my, my account managers here that go in and because you have bad meetings, right? When you're in client services, it's the nature of what you do. Thankfully, we don't have a lot of them, which is great. But yeah, it was an interesting change for me, because now I'm all client facing and I'm dealing with, keeping the clients happy. And it allowed me to see everything from a different perspective. Right. You sit in operations, especially in a small business, and you're not getting the chance to get out in front of the customers. And it's something we stress today, more importantly now than ever, is you kind of get in your own little tunnel, right? You're doing everything operationally you think is the right way to do it, but you're not fully understanding the impact on the client. And I think that when you talk about my role today, having had the opportunity to run operations for a long time and then sit in a client facing role for a long time, I've seen both perspectives. And sometimes they have conflicting or competing priorities. And I think that was part of the reason I think we're so successful with our clients now is we view it the way it allowed me to view it from a little different perspective. It was interesting. I mean, the title sounds good. I was SVP of Client Services, but I was the only one, right? At that time, I wasn't managing any people.
Okay.
Because it was just me, right? I mean, at the time, I can't remember what we had for clients, but I may have had maybe 18, something like that. I think clients. Yeah. But I was ultimately, even though I had a senior VP role, it was more of an individual, back to being an individual contributor role. Come back and work with the management team to say, hey, here's what Dr. Jones's practice is experiencing. How can we help mitigate that, right?
So you said that your mother-in-law, one of the owners, decided to move more into the operational role. So was this like a trade-off between the two of you? Like
a little bit.
She wanted to come back to operations and give you the opportunity to do the client-facing portion?
It was, yeah. It was an opportunity for me to develop my skill set, and and partially she enjoyed the operations piece more than the client piece. Right. So it gave me a chance. So we ultimately, I think at that time, almost completely flipped roles. So
was that an intentional decision on her part to develop you for potentially taking leadership later on?
Yeah, 100%. And again, similar to what you see in a large company, right? You do, a good buddy of mine works for a large pharmaceutical, and he's done probably 12 different roles to prepare him for his career path, right? And that was really the key piece. One thing they were always great with, several things, but one of the things is allowing me to develop, right, and get into these different roles. And I think the intent was at that point, I've now been with the business, 15 years, give or take, something like that, 13 years. I had envisioned staying there long term at that point, right? Did I think it'd be 30 years? Who knows? But yeah, the intent of the switch was to groom me and help me, learn different skill sets. And I use that technique to this day with our staff here.
So you went into that first meeting with the doctor in Dorchester. You said you weren't prepared. So
Right.
tell us a little bit about what was it you learned from that encounter? Like how were you not prepared, and kind of what did you learn, and how is that shaped? You said you've taken that experience and you now share it. So what was it you learned about being prepared? And
Yeah, I think a couple of things. One is I really, everybody in those situations, you got to realize everybody's human and they're all trying to run their own business, right? So it's never personal. But the biggest thing I learned is making sure when you're presenting the data, make sure you understand all the pieces of the data, right? And that was the key part for me is there's in healthcare, and I'm sure it's in every business, but in the RCM world, we're dealing with a lot of complex individual pieces, right? Maybe in a primary care practice, a little more standard, but you go into an orthopedic practice, they're going to want to have you understand how they're getting paid for shoulder surgeries, how they're getting paid for their knee scopes, what's happening with their total joints, how's their office, how is the office volume impacting their revenue, right? All these kind of core details. And this primary care group was a little more complex. They had their own laboratory. They actually had their own x-ray at the time. So they wanted some details that I wasn't prepared to give. And they weren't overly thrilled that I wasn't prepared to give those details. Right? So it was a little bit of learning that piece. And that's where, what we role play now and ask our staff to say, hey, first time you're going to go present to a client, why don't you present to the leadership group first or some of your peers and let's go through it. I didn't have that opportunity back, then, right? And it would probably, would have helped us all, but it was I like learning on the job anyway. And that was definitely an on the job experience. Really question, but it was really just about knowing the numbers and getting the ability to make sure that you can, if you understand, if you can't answer their question, then make sure that you at least have an understanding of the, and set the expectations so you'll get back to them timely.
Yeah. I mean, I have briefed a lot of doctors in my time, so I know, they're data people. They like their data and they will dig into it. And it's part of how they kind of sniff out whether you're competent or not. They, big on it. All right.
I don't know it better than they. That's our philosophy here now, is making sure. And that's how we've been fortunate to have great client retention. And part of that is because we know the data, we know how to, what information they really need to understand without giving them way too much data that's overwhelming.
Right.
And two, we also, if we don't know it, we own it and we figure it out. Right. I mean, that's the other part I think that's important.
So in 2007, you were promoted to be president. So what was the decision process there? So you have the owners, you'd kind of traded roles with your mother-in-law. She decided to come back to operations. What was the decision within the business that they needed a president and that you were ready for it?
Yeah, so a couple of things influenced it. One is I also became a partner at that time, so I bought into the business. So they were looking to start to transition the business at the same time, right? And at that point, they were still fairly young, but they built a fairly very successful business. The options were going to be, do they sell it internally, right, to their now time son-in-law, and my wife, who's also an owner in the business, never really worked in the business other than doing some basic administrative functions. She was a school teacher, so she was off doing her own thing, which was great. And so we were beginning to talk about the transition phase. What's next, right? They're thinking about retirement, and do they sell the business? Do I take it over? And so on. So I ultimately, with some help from them, purchased I think at the time I purchased 20% of the business. And at that time, they also said, look, I think proven myself enough over the years. I had different visions for the business. They wanted to keep a stable business, and people use the term lifestyle business. I think it was maybe a little more than a lifestyle business. And at the time, we talked about me pushing growth and trying to really take the business, to some different levels, right? And that's the part that challenged me. And if you ask anybody I work with, so it's always about the next, what can we do to get to the next level, right? It's about challenging ourselves and growing the business. And that's what I was, at the time we were going through. And they ultimately said they were very, very willing to let me take the reins. And again, I'd proven myself for 17 years at that point, right? So they knew what they were getting. At that point, I didn't see any idea that I was going to leave the business, right? I wanted to own my own business, and this was my best opportunity to own my own business. I'd grown to love RCM, even though it's not the most exciting topic when you talk about it, but it's kind of a cool, really cool industry, so it was a little bit of a transition plan. It was my chance to get some ownership in the business and take it from there.
How would you say your previous assignments had prepared you for that role, and why was it why was it appropriate for them to sell internally to promote you, and as opposed to, say, selling it and maybe allowing somebody else to bring in their own management team?
Yeah. So, and I think, quite frankly, they would have been, from a financial standpoint, they probably would have been better off, from a financial standpoint, selling it externally, right? I think, I got the family and friends discount, but yeah. So two things I would say: the jobs I had done prepared me, and I don't ever take it lightly. And again, I still talk about it to this day with all the employees we have, about the fact that I've been able to see every role. And there are times, even today, I'll go sit in the call center and take patient calls, right? Just so I understand what's going on. And I think, I did it for a week last year, and at some point I'll do it again this year. But it just lets me, having all those different experiences allowed me to understand all the impact on the business, right? Good and bad, but you get to see all aspects. So a lot of the failures I had from a management standpoint definitely prepared me for a bigger role without question. But the other part was, I knew what happened if you posted a payment wrong. I knew what happened if you didn't take a patient's call and solve their problem. I knew what happened if you didn't deliver to the client timely, right? So I had a good understanding of all aspects of the business, except for the technology side. That was the one area that I made sure we hired correctly and brought in the right people, because I knew what we needed from a technology standpoint, but I was never, if you look at my resume, that's one role I never did and never had. And that was a part of my brain doesn't function that way. So I never get into the technology side. I have a hard time using my smartphone. But so I think having the diversity and having all of that diversity in my work history really prepped me well for leading the organization at that time, which at the time was about 25% of the size it is today. So.
Oh, okay. So how big was it roughly?
Yeah, I think at the time we were probably, I think if I recall, we were doing about $1.8 million in revenue, something in that range. And we had maybe, I think, 30 clients, something in that size, and probably similar size employees. It was almost a 1-to-1 ratio, I think, at that time, give or take, from a client standpoint, some bigger clients. But but similar. I think that's what we were.
So kind of fast forwarding now, I guess, how active are you still partners with the founders? Are they still involved with the business, or?
So they are not. They they actually retired, more or less. My mother-in-law still does a little bit of work just from a compliance standpoint for us, but they retired 10 years ago. Yeah. So
okay.
So it was a pretty quick transition.
Okay.
Over in 2007 as a partner, they both. My father-in-law retired a little bit earlier, but I think it was about 2010, something like that. They've been 2011. So, but they're still. And then we took over complete ownership in the last 3 years. So we had slowly bought majority ownership, and my wife obviously owns a chunk of it now too. But my wife and I own the business outright, but we had owned the majority for the last 10 years. It all blurs, but yeah.
Right. So you and your wife are the co-owners of the business now. So you don't have another entity, a board, or other owners who you're reporting to. This is you're the president and you're the owner.
Correct. Yeah.
Okay. So being a privately held company, what are the advantages and disadvantages of that?
Yeah. So it is interesting. So we've always been committed to being independent, and I think for a couple of reasons. We like being independent, and I think the biggest advantage is you're responsible to your employees, yourself, and your clients, right? You're not responsible to stockholders and private equity and so on. So it gives you a little different view of your market. I think that allows us to be super flexible. We still have a board an advisory board is really not a oversight board, but so people that we can bounce ideas off of and give us guidance on the business. But it is interesting because I think as a privately held, we're responsible to our clients. We can be super nimble and really adjust and pivot when we need to quickly and make decisions quick. I think the biggest disadvantage that I've seen is we've grown the business and actually, we're actually about 6 times our size. So I take that today that we were, in 2007. But growing the business without having outside capital is challenging, right? So we fund the business growth with our own revenue. So it means we're going to grow slower. Means we're going to have some additional challenges, and we're going to have to do things a little differently from that standpoint. And I think that is little bit of a challenge without question. I think one of the downsides of staying independent and staying, not taking that outside investment. The other part is really, leveraging some of the networks you get sometimes when you take private equity money or you sell to a larger competitor, right? And our industry right now is going through tremendous consolidation. All the businesses that we started with when I joined here in the late 80s, early 90s, there was a whole bunch of companies like us popping up around us. Yeah, so I think part, is interesting is being independent, with the pros and cons of being independent. The other part is that we've seen a lot of consolidation in our industry, and being one of the few independents of our size left has, I think, helped us. So a lot of the people, when I got into the business in the late 80s, early 90s, there was a whole bunch of us in the region, similar size, jumping into the RCM business. And to this day, I think the 7 or 8 biggest competitors that I had, have all either sold out or gone out of business. And, and that's where a lot of it was consolidation. There's been a lot of influence from internationally on our industry too. So really changed things. So I think the other flip side of us, and the reason we've committed to being independent, is it gives us a little bit of a competitive advantage in a market where everybody is got some investment from somebody and some different approaches and different obligations, I guess.
Your competitors now, you're competing with national and international size firms?
Yeah, I mean, is everybody, in our industry, there's the Athenas and the Optums of the world, right? Everybody sees them and we compete against them. It's different. I mean, we're different animals. If you're going to work with an independent company like us, you're probably not going to work with Athena, but we also do support sites that work with those vendors and ourselves. And then there is still a chunk of, there's not a lot of startups in our business. If you notice, RCM startups, there was a bunch in the 90s and 2000s, and I think everybody's realized because it's become so regulated and reimbursements have shrunk, and we talk about value-based health and so on. I think a lot of people have not gotten into the business, but a lot of the big competitors have bought up all the small competitors, right? That if it's NextGen or Allscripts or whoever it is, they're all getting into the revenue cycle world. But it is and then there's also a huge investment push from India, right? India's got there's a lot of India-based billing services that has really pushed on it. And we use some offshore resources, but in a much different capacity than that as well. But it's changed the landscape dramatically.
Landscape for RCM businesses has changed. And then the landscape for your clients has changed as well. So in the time that you've been involved in the business, you've seen an awful lot of consolidation, both with practices consolidating. So your mom and pop or your doc with a black bag is kind of gone. Most primary care docs don't function outside of a group these days, whereas in the 90s that was still a thing that you could see. And as well as insurers have been consolidating, especially since health reform has occurred. So talk about your typical client. Who are you working with these days?
Yeah, and so we, our clients vary from still independent practices all the way up to hospital-owned and ambulatory surgical centers. And our typical client is probably a physician practice, can be hospital-owned, can be private equity-owned. That's a new change in the last 3 to 5 years, right? And they're typically probably 50 million or less in revenue. So we have some that are still some single docs, 2 doc practices that do, that are smaller, but our typical site now is pushing, 10 to 15 million in revenue, and primarily because of our focus has been in specialty care. We do a lot of orthopedics, a lot of ophthalmology, and a lot of ambulatory surgical centers. And then we do a whole bunch of other specialty driven, pulmonary and general surgery, bariatrics, things like that, and less primary care than we did today. We used to do a lot of primary care in the 90s.
Right.
Had these, a lot of independent practices, right, to your point. And the bulk of the consolidation has been on the primary care side, not so much on the other side. It's some specialties, but cardiology and primary care, I think, is where we've seen the biggest effect on our business, where most of them consolidated or been hospital owned at that point. But we do, we do hospital contracts, but primarily all outpatient. So we don't typically get involved with inpatient medical billing. It's all, outpatient-based practices and a lot of specialty care driven.
Okay. Yeah, I guess I would say, I would have to temper my observation by saying it's mostly, you still see some specialties out there one man, one woman shops, right?
There, yeah.
But it's not the primary care has pretty much all been consolidated. It's are there a few?
I still have 8 or 9 independent primary cares. Believe it or not.
No kidding.
Yeah,
Okay.
either single,
Just one
or two. Yeah. 1 or 2 docs, maybe a nurse practitioner or a PA, or a couple of nurse practitioners. So they're still around. They're all part of these large organizations. They're independently, they're still, self-employed technically, but they're part of large PHOs or IPAs. That's the only way you're surviving. But there's not a lot of that. There's less of that all the time, I think, is the main point. Yeah.
So why do they reach out to you?
Yeah, it's interesting. So they will come to us for various reasons. And I think sometimes it's technology, right? Their systems internally are failing and they need help with technology, because we do offer technology solutions as well as rev cycle solutions. But more often than not, they're coming to us because their financial performance is poor, right? So their receivables are high, their average payment per claim is low. They've got issues with timely filings and coding and compliance. So and I would say the other reason that they would come to us is staffing. They can't find the healthcare market. Even today is still the most competitive employment market, I think, in the country. Right? It's hard to find people that understand revenue cycle in our world, right? And if you can't develop them yourself, you're not going to have the talent. There's a lot of sites, they're not performing financially. The other big piece is, do they have the talent, or can they find the talent to do it internally, right? And there's not a lot of RCM talent in this region, in this country, quite frankly. And so a lot of times they'll come to us and say, look, we just can't develop our staff. We can't find the right people to do it. We can't scale. So as practices consolidate, and this is happening a lot in ophthalmology and orthopedics, they need stronger skill sets to run the revenue cycle billing department, right? When it was 2 or 3 providers, almost, it's a lot easier to manage. Now that you've got 20 providers and you're running a multi-million-dollar business, you need a lot different skill set to keep your revenue cycle on track. And a lot of that now ties, it's not just collecting the claims, it's making sure you're scheduling correctly. It's making sure that you're maximizing your eligibility and your check-in process. So there's a whole bunch of pieces that come to it. So for us, it's 90% of the reasons are staffing and financial performance, I would say, is the reason we get a call.
Can you help me out for a minute, because this will be great for my teaching.
Yeah.
What are accounts receivable, and why is it a problem if it's too high?
Yeah. So, and this is, accounts receivable ultimately in the healthcare world are your outstanding claims to insurance and patients, right?
Okay.
So in my world, our receivables are my invoices to the clients. In the healthcare world, it's all your claims submitted to the insurance and your outstanding patient balances. And in an ideal world, you want that to be about 35 days of your work, 35 to 40 days of your work. So if you figure out an average day, you generate X dollars, multiply that by 40, and your receivables should be ideally less than that, right? And then and what ends up happening is, with the complex regulations, new requirements, a lot of things around medical necessity now, and so on, it gets complex if you're not getting your claims out correctly, you're not going to get paid. And the payers have they're not going to push a claim through just because they like you. Like in the old days, you could call them and they push a claim through. Nowadays, there's a lot more work that goes into it. So if your receivables are growing, that means you're just leaving, in some cases, tens of thousands, in some cases, hundreds of thousands, in some cases, millions of dollars sitting on the books that should be collectible money. And nowadays, with practice margins shrinking, it doesn't matter what specialty you're in, their margins are all shrinking. So every penny counts. And a 3 or 4 or 5% improvement in the receivables is substantial money. It's a difference between having a successful year and not for a lot of these practices.
So you talked a minute ago about some of the things you're doing. So aside from, managing, helping manage the billing itself, you talked about scheduling and some other stuff, which really gets into operations more. It's not just, hey, send us your bills or send us your encounter data and we'll turn it into a bill and send it out for you. Yeah. This sounds like there's a lot more. You are deeper into their businesses than that.
Yeah, this is the revenue cycle ecosystem, and you'll see us use that term a lot on our marketing material on our website. It used to be revenue cycle was focused on the back end. Your job was to get the claim and get it paid. But right now, for us, I would say half of our work is on the front end, meaning that we want more than half, probably closer to 60 or 70%, is to make sure that they're gathering the right information. Are they checking right patient's insurance information? Are they making sure the patient's eligible. Are they collecting the copay? Are they collecting the right amount? Are they clinically documenting correctly? Right. 20 years ago, I wasn't worried about whether or not the doc and the provider, had a clear documentation in their note. But now so many claims are reviewed because of EHR, that information's there. So we support our clients on that piece, right? So when we think about the ecosystem, it's front end, registration, eligibility, copay collection, the scheduling piece. And then you go to the clinical piece, which is the documentation, the coding. Are the providers documenting and billing for everything they should? You'd be surprised how many practices leave off services that are actually payable services and then include services that you have to clean out because they're not billable services. So those two pieces ultimately result in the back end. And more of our work gets shifted to those first two, the scheduling and the clinical, and less on the back end piece all along. And we've developed technology and worked with vendors to push our focus to the front end to make sure that we're getting clean claims out, which in turn helps the insurance companies. If they're getting a clean claim, they don't have to manually review or do whatever. It makes it much cleaner for them, and then you get paid quicker. And that's the key part here. So,
and that reduces the accounts receivable.
Reduces the receivable, reduces cost for everybody, and really keeps the practice running efficiently.
Well, tell me a little bit about kind of that front end portion of your business. Do you put people physically in the practices to help them with that process, or how does that work?
Yeah, we do.
Or you provide them technology?
Yeah, part of our approach is pretty modular, and we have full service, which means we're doing all aspects of your revenue cycle, and then we have pieces that we'll pick up chunks here and there. So we will have people on site if need be. That's typically in larger practices. We will offer technology if they need it. We provide a scheduling and billing platform if the practices don't already have one to interface with their EMR. And then we will, also bring in, an analytics reporting tool, which is more back end. But the other big piece that we bring into all of our sites now is a rules engine. So we're actually the first customer for this company. I'll give them their free marketing plug out of a company called RCX Rules out of Burlington, Vermont. Great friend of ours. They're a bunch of guys that had been part of IDX, which is a big software company out of Burlington, Vermont for years. Got into this company and been running this company for a while and growing it. But we were actually their first customer. And it's a front-end rules-based technology. So it scrubs, prior to the claim even getting created and going to the payer, it scrubs the claim to make sure it's accurate. So we have thousands of edits, from payer edits to custom edits built into it. So we will, we know if Dr. Jones sees patients on Tuesday at the office in Derry, he can't bill, his x-rays are not billable, or, various things like that. Or we know that Dr. Jones should never be in Derry on a Tuesday. So if something shows up with Dr. Jones being in Derry on a Tuesday, let it fail the claim and we'll take a look at it. So we invested a lot of resources and people talent into that piece, and it allows us to really get the front end claim piece super clean before it even gets into our system and even gets to the payer. And that's the biggest, I think, industry change. And you'll see the bigger competitors have things similar. It's really the focus, right? Because in the RCM industry, if you're chasing the claim on the back end, you're losing money usually, right? Because managing denials and managing AR is a costly, cumbersome process still to this day. I mean, it'll get better, I think, as we talk about AI and everybody pushes through some of the ability for automation there. And we've done some, but yeah, really the focus is on that front end rules and edits system that allows us to get the claim clean and give feedback to the provider. We can give them a dash where they can see, hey, these 5 patients, I didn't document, what my services were, or the diagnosis doesn't warrant the procedure. Did I include everything I did, and so on.
That's kind of more of the back end, right? That's more of the back end, the feedback about how you document it. It's
right after the clinical. So it's before it gets to the insurance company. So it's in that ecosystem, middle of the ecosystem ultimately.
Okay. So middle.
Yeah.
Okay. So you're providing the physicians and other providers feedback about how they're coding and what they're choosing. And, hey, you could have, did you do this? Because this could, if you add that code, it would increase the value. Is that an accurate?
Yeah, making sure that they have it documented, that they're billing for what they document and they document for what they bill, right? I mean, that's the key piece, and making sure that they're covering all their basis and capturing what they can appropriately.
So, as president, what's a day in the life, Brian, these days look like?
Yeah.
What do you do? What do you do to with the business?
Yeah, a day in my life today was different than it was 3 weeks ago. I will assure you.
That's true.
But prior to, we'll go back 3 or 4 weeks. But for me, it's and I get a quick typical day is I would start my day by a bunch of quick 30 minutes or 45 minutes of current events, what's going on in the healthcare world, from modern medicine and a bunch of different subscriptions I have. I'll quickly peruse articles, see what's popping up there. Obviously, news, normal news feeds and so on. Just understand nationally what's happening in healthcare, and then locally from MUR to the globe and things that are in the region that really have an impact on it. And then there's a whole bunch of other subscriptions. So that, for me, that's part of my role. The other part is obviously checking, I'll depending on the day of the week, I may have a leadership meeting already scheduled where we'll talk about, strategy for that week, making sure we stay on target. I'm also looking at metrics every day. So we have a robust analytics package. So part of when I'm drinking my coffee is to look at our dash and see where we quickly know where we are on target or not on target. Are we behind in this, payment posting? Are we ahead here? Where are things falling? How are our clients trending? So that's a chunk of my every morning for me. The rest of the day may vary from business development roles where I may be meeting with large practices where I get called in to be kind of the glass closer, I guess, in those cases. Maybe key client meetings. I'm the executive sponsor for a group of our core business clients. And then obviously networking and that piece. And then the other part is really just continuing to develop the strategy of the business, right? And work, making sure that I understand everything that's going on around us. I mean, I think that's the biggest part of my role is what are our competitors doing? What's the industry doing? What's, in this world today, what's value-based healthcare, impacting us? So a lot of my time is spent in that area. And then ultimately being the little bit of the face of the business, right? Whether or not it's promoting our brand, in the community or LinkedIn or whatever it might be. I think that's a big part of my role.
So talk a little bit about the structure of your organization. Like you're a president. It's a mature business now.
Yes.
What is the organizational structure of the business?
Yeah, and if you spent a day with us, you'd maybe not know that you wouldn't think we're mature. We have a lot of fun.
Let's go
from a business standpoint, but mentally, I'm not sure we're all mature, but we have some fun. But so right now, we have my CIO, right, Chief Information Officer, charge of technology, new products, integration, maximizing our products. So he reports to me. Chief Marketing Officer, right, and when we say marketing for us, it's about communication internally and to our clients. We don't do a lot of external marketing other than our sales is really driven through channels. But so Chief CMO, VP of Client Services, that role, the role that I had years ago, and that's a big, and there's actually 7 or 8 people in that department now. Our controller, obviously financially, reports to me. Recently, a VP of Ops that's going to run all of our operations, and then our senior advisor in business development. So those are the key roles right now that report to me. And I think, ultimately that's aside from I think that's every role that reports to me. Yeah.
All right. How many employees are you working with these days?
Yeah. So we will, at the end of this month, we'll have 81 on staff here, and then we have another 70 contracted. So we're up to about 150. We partner with a couple of companies, one out of Salt Lake City, Utah, that we use for some back-end functions, and then another one that does a little bit of India-based offshore support as well on basic functions like manual payment posting if we have to deal with that, things like that. So
we mentioned at the beginning that we are in a unique time, and hopefully we won't be in this unique time for too much longer. But how is the COVID-19 threat affecting PRL and your business, your day-to-day operations? What's beyond the obvious personal risks, what's the impact on the business?
Interesting enough, and I haven't been here a long time. I've lived through H1N1. I've seen 9/11. Market crashes, healthcare reform, right, Obamacare, all these things that they thought were going to have huge impacts on our business, and our world has always been fairly isolated, right? If I see a 3 or 4% drop in our revenue or something like that, it's because of outside influences. It's aside from competition, it would be rare. This is a different animal for us. Probably 75% of our practices have either closed or cut their resources, laid off most of their staff, and only have, if they were a 20 doc practice, they have 2 docs working, right? And those 2 docs aren't working anywhere near capacity. So we've got an interesting ride for the next couple of months. And our staff is well aware of it. It's going to be challenging primarily because, routine, you think about all the routine surgeries, and we do a lot of orthopedics and a lot of ophthalmology and a lot of ambulatory surgical centers. All of our surgery centers are closed. Ophthalmology's not really treating patients unless it's urgent, primarily because of the way the disease is carried, and they can't get the protective gear that they need, right? And then orthopedics is the same. They're not doing any elective surgery. Most of these ORs are closed for at least, from an elective standpoint, for the next 2 months. It looks like, at least until June. So the good news is we're getting a chance to focus on internal projects, really cleaning up our receivables for our clients, because the way the industry works is we always have a backlog, 60 days of receivables for our clients, right? Because you're waiting for payers to process and so on. So there's still money to be collected. We're using it as a time to really develop some internal staffing and really clean up some key projects that we hadn't had a chance to get to. So it's having an impact, and it's, I would say, singly the most challenging leadership time that I've had since I've been to this company. And I think, if you talk to a lot of business leaders in various industries, doesn't matter if it's restaurants or healthcare, that I think they're all feeling things that they've never had to deal with, from the hotel industry all the way through, right? We're all getting some substantial impact from this.
Well, let's transition and talk a little bit about leadership. What would you say is your leadership philosophy?
Yeah, for me, it's pretty simple. Hire the right people, give them the right tools, and give them the freedom to do their job. And at the same time, push them to continually develop. I've been fortunate enough to have a leadership group that's been with me for a long time. In most cases, a couple that have, as we grow, we've brought in. But for me, it's if you get the right people, the rest of it kind of takes care of itself. And that's the hardest part, right? I think, and then just giving them the freedom to do their job and the tools they need is the key part. So that's the way I've looked at it I've gotten better at it. Early on, that was, you change your approach. And in the last 10 or 12 years, we've been incredibly fortunate to find the right people, and it makes my life a lot easier.
Do you have a leader that you admire that maybe you've tried to model after?
It's interesting. If you ask my staff, it's funny, I always quote Churchill, but I don't know that I would ever, I don't just, I definitely admire him, but it is funny. If you get the last few years, it's one of the people that I think I glean a lot from and I follow a lot is Mark Cuban, who I think he's a different kind of leader. He's edgy, but one of the things I've always admired about him is he's always people first. He's always business first, and he's not afraid to speak his mind. So he's somebody that I've spent a lot of time following the last few years, just because I've enjoyed the way he approached it. He's done some things that I wish he wouldn't have done, but it is interesting. Yeah.
What characteristics do you think make a good leader?
Yeah, I think several things, right? And I think if you think about, our values, for me, it's always integrity, right? Being comfortable in your own skin, being open, right? I think a lot of leaders feel like they can't show their emotions and not be fully transparent. And I've, maybe to a fault, but I don't think so. I've always been very open with our staff. I think that's a key part. When we bring people in here and look for new leaders, we want them to be, one, comfortable communicating and showing their emotions and not being afraid to say, hey, I made a mistake and I apologize for it and I'll fix it. I think the other piece is not being afraid to fail, right? And I had that opportunity and just with my upbringing, I got a lot of opportunity to kind of spread my wings. And I think the biggest thing I find now with new leaders, and I think some of the younger generation, is a little bit of that fear of failure, right? And I think that as a leader, you have to be comfortable with failure or it really handcuffs you. So we look for people that have, when we do interviews and we talk about it, if someone tells me that if they can't come up with a couple of really major failures along the way in their management career, tells me that they probably aren't someone that's going to fit here anyway. We want people that have learned from their mistakes and made some, hopefully nothing, that life-threatening, but some substantial mistakes, right? I mean, that's part of it. So that's really when I get to sit down and interview for somebody, that's one of the first questions. And, we just went through with our VP Ops, and that's what attracted me to him is his life lessons were pretty substantial and his management lessons were pretty substantial. And I think that makes a good leader. I think being creative and not being afraid to take that risk, I think is the key part for me on that side. And we're not afraid to pivot quickly, which means if we put something in place or we change an operational flow or we change add a new service, you have to, and if it was my decision, I have to be comfortable. And as a leader, you have to be comfortable saying that was a mistake, right? And don't let your pride get in the way, right? I mean, I think that's the biggest thing is you got to be comfortable pivoting. So those are For me, well, if you look at our company goals, it's integrity, commitment, and innovation. And a lot of those communications part of that and risk and so on. So
you talked about the importance of learning from failure. So one of the questions I like to ask is, can you give an example of a difficult leadership lesson that you've had to learn the hard way?
Yeah, I think, and I could give you several, but I'll give you, and I did this a few times. I think, as I was learning to be, whether or not it was in the the billing manager role or the RCM director primarily, and then into the president's role, for me, it was about the single biggest lesson I learned several times was not having those difficult conversations, right? So someone maybe wasn't performing at the level they should be, or didn't handle the situation the way I felt they would be, and I held back and didn't share my feedback on that, right? And I think that's the biggest thing any young leader should keep in mind is, right, you have to have those uncomfortable conversations. And by not having them, you're actually hurting yourself and hurting that other person in the long run. And I think that for me was it's the hardest thing to learn, right? Because no one enjoys, you learn how to tolerate them, but you don't really enjoy, nobody I think ever enjoys those conversations. So you have to get comfortable doing that. And I think that was the biggest thing, because I over the years probably lost a couple of good people because we didn't have those candid conversations.
You've talked, you made a kind of a joke about maybe it's a mature business, but you wouldn't know that you were mature, I think.
Yeah.
And so my sense is here, you're kind of saying you have a particular culture in your organization. Can you talk a little bit about that and how you've tried to cultivate that culture? Yeah,
we've focused and I think we're better at it. We're never at the level I want us to be, right? I think you can always get better at that piece. For us, it's about open. One of the things I always suggest to everybody that comes in here as an employee or a leader or whatever it might be is, we've spent a lot of time on like the 5 dysfunctions of a team book, right? And everybody.
Oh, great. Lencioni, good book.
Yeah, and I think it's almost a little bit of a Bible on how you approach things. But for me, it's having a culture where everybody assumes leaders have to hold everybody accountable. We're trying to build an environment here where everybody holds everybody accountable, right? Co-workers and so on. And everybody's comfortable saying, hey, that's not probably, we all should keep each other in line and both ways, right? We want people to be comfortable coming to a leader and saying, hey, I think you could do that a little differently and a little better in this way, right? And delivering it the right way in professional manner is key part, but really an open communication. We have a lot of people that work really, really hard, and part of that is also balancing that with fun. So we built a culture around that. I would say accountability, open communication, and accountability both ways, right? To peer-to-peer, leadership to team, and then team up to leadership. The other part is the community involvement piece. We've really pushed that. It's been a part of what I've done for the last 20 years, probably anyway. But as a company now, we've gone to the point of putting in paid volunteer time. We've really pushed our staff. We created a volunteer committee, and they've been tremendous. Just keeping up and supporting things like Big Brothers, Big Sisters, and Boys and Girls Club, and Marguerite's Place, and others I'm sure I'm missing. But we do we do a lot around that piece. And I do feel, and I always have, is every company has a responsibility to the community, and we're building that within our staff. And I think by giving everybody paid time off to do it, it really shows our commitment to it. So that's part of the other piece of the culture we're building.
I want to ask about mentorship. What does a good mentor do, and did you have mentors coming up through your career?
Yeah, it's interesting. I'll answer the second question first. So yes, I had from my standpoint, and I'll go back and to really was my grandfather, and part of he was always comfortable speaking his mind, and he was a self-taught businessman. So he really guided me, I think, in a lot of ways, and instilled a lot of characteristics in me that I still have to this day. And so I'd say he was a big piece of it. And part of it is just being with all these mentors, is just being a sounding board, being able to give you candid feedback and say, hey, Brian, that's really not a great idea, or that's not the way to do it, or that is a great idea. I would say without question, my mother-in-law has been tremendous. I mean, we've working in a family business is a different challenge. I think there's a reason that you can actually get a degree in family business now, right? Or they teach that track at some schools. It's a different dynamic, and she was a tremendous influence on me. And I think primarily because she let me try things and fail and develop. And I don't think the company would be where it is today with all of that. But I would say those are probably the two biggest.
Let's talk for a second. I hadn't asked you enough about the family business aspect of this. Like, how was your experience? How has your career been different because you were in a family business? When did you marry your wife?
So we got married in '94. So
Okay,
after I joined.
so you've been part of the family for, I mean, it was like 2 years, and then you were, so you were not only working for your mother-in-law, but you were having Sunday dinner as well with your boss.
And sometimes Friday and Saturday dinner. Yeah. So and to take you back a little bit, I grew up in a family dairy farm, and I would have been the fourth generation of that family dairy farm. So and that included my parents, uncles, aunts, everybody. So and I don't know if it was in my blood and I just subconsciously ended up in another family business. I'm not sure how that worked, but it's a different dynamic, right? And you have the biggest thing, and I would say it's similar to working with friends and family, right? You have to be able to separate business and professional. And that's not easy. I mean, especially in a growing business, if you're working 12, 14-hour days and you're doing that 6 days a week and you're grinding through everything and you see each other every day and then you go home and have dinner together, it's a different dynamic, right? And again, it goes back to being comfortable having candid conversations and setting bounds and saying, look, when we have dinner, we're not talking business, right? Or when we all go on vacation together, we don't talk business, right? I mean, or you do talk business depending on how you approach it, but you have to set boundaries on it. So I think that was the biggest thing. And it's weird because it does get in your blood, and it'll be interesting to see, I have 2 boys, interesting to see where they end up, in the scheme of things here too. One's in college and one's in high school, but it's a different dynamic, but I wouldn't trade it for anything.
Well, let me close on this then. So, I teach an undergrad program. We've talked about it. We've got a lot of young folks interested in finance. So for a young person thinking about a career in healthcare, why should they think about a career in health finance and specifically revenue cycle? Yeah,
I think the world's evolving in rev cycle, right? We're talking value-based healthcare, and it's pushing in a whole different direction. There's an opportunity, if you're not going to be clinical, there's a huge opportunity to have an impact on our healthcare industry in so many ways. And it's a growing industry. It's an industry that's finally catching up technology-wise with the rest of the world, right? Healthcare has always been a little bit behind technology-wise and process-wise, and it's being forced. And I think this, even through this most recent COVID crisis, I think is forcing us to adopt technology quicker and adopt, processes quicker. So I think it's, you have an opportunity in this business to meet some really incredible people and be part of something that it feasibly is potentially saving substantial money for the healthcare system and providing businesses with these independent practices and even these hospital-owned practices with the ability to thrive, in a challenging environment. Brian, thank you so much for your time today. I appreciate it. Yeah, absolute pleasure. I appreciate it.
You've been listening to the Health Leader Forge, a joint production of the College of Health and Human Services at the University of New Hampshire and the Northern New England Association of Healthcare Executives. Please go to our website, healthleaderforge.org, for more information or to leave comments about today's podcast. Look for Health Leader Forge podcasts on iTunes, Stitcher, SoundCloud, and other podcast distribution sites. Thanks for being a part of the Health Leader Forge community, and we'll talk with you again soon.